it's almost this gaslighting of a patient to be able to say, I'm just asking good questions. I want to be a good advocate for myself. Is this
Mhm.
out there? And that's what I always tell patients. Be an advocate for yourself because you're more intelligent than you think you are. And you want to make sure that you're asking questions. And if something's not feeling right, ask the questions because you should have a doctor that loves to accept questions. I mean,
Right.
I'm a researcher but I love research. I'm inquisitive. I want to know what is going on so that we actually can have those answers. I don't know everything. I certainly don't claim to know everything, but I do know that when it comes to that ability of seeking and finding those answers and looking for data behind it, it becomes illuminating of what we actually see. So cancer is one of those areas. Chronic diseases, autoimmune, neurodegenerative, dementia, Alzheimer's. These is it's another dynamic. What's actually the root cause? I love that fibromyalgia is, pain in all four quadrants, and yet nobody really knows what's the actual root cause of fibromyalgia. And when you start testing, then you can actually see where are these potential toxins, these hormone endocrine disruptors, seeing infections, chronic viral, right? Again, Epstein-Barr virus, these other chronic viral infections that can be correlated. This is where when you start to see these levels, then you can start having a treatment plan to be able to treat it. I'll share. I know you guys probably know the story too. Fibromyalgia wasn't a diagnosis when I first came onto medicine, right?
No, yeah,
It
30 years
wasn't a
ago. Huh?
diagnosis. What was the treatment for it? It was that you had to be referred to a psychiatrist because it was in
Exactly.
your head. Okay,
Mhm.
when did fibromyalgia finally? What kickstarted the process of actually having a ICD-10 diagnosis for fibromyalgia? It
Mm,
was when there was a convenient drug that started coming on the market and being done in research called Lyrica.
Right.
Lyrica was the drug that was finally approved for fibromyalgia. But this was not generally accepted into the actual mainstream medical system until there was a drug that was finally able to be prescribed for it. Very expensive. And yet it doesn't do anything to do with looking at why do you have
yeah,
pain in all four
Mhm.
quadrants?
right.
What's going on with the system? Why are we anxious? Why are we not sleeping? And so this is where when you start to actually unravel and unpack, Janet, like you were saying, sometimes these things are just, they're not as difficult as we actually make them out to be. We're just not looking at this. What is your nutrient status of magnesium? How is your sleep habits? Are we actually on screen time?
Yep.
These blue lights that continue to excite our brains that don't allow our sleep. What's the relationship like with your significant other? Have you had forgiveness? All of these dynamics that are then playing a role in our mental health, our anxiety. What's the GI tract doing with the ability of having microbiome health that is signaling potentially these other issues with anxiety and depression? How
Right.
is our diets? Are we even exercising? Are we getting out, creating natural endorphins, just moving? So if exercise was a drug, it would be the very best
I
blockbuster
agree.
cancer drug. It would be the
I
blockbuster
agree.
cancer drug, but it's not being
Well, not
done, and
only
it's not
that, but
even being recommended.
no.
And
No.
so you
Yeah.
see this therapeutic fasting is a beautiful thing. This intermittent fasting. So these
Yep.
diets that actually can augment the outcomes.